This is the Dr. Berg Show. Live from the nation's capital, it's time to get healthy, lose weight, and feel great. Call now to speak with Dr. Berg at 866-561-4292. And now, Dr. Eric Berg.
Hey guys, we're back. It is Friday morning. Probably in other parts of the country, it's Friday night. But welcome back. We're going to do some live Q&A today. There's a lot of questions, so I'm just going to chop away. We'll take one at a time. The first one comes from Omaha, from Randy. Randy, go ahead. You're on the air.
Hi, Dr. Berg. Thank you very much for everything you're doing. I was diagnosed with diabetes about 11 years ago, and within the last 3 weeks when I first discovered your videos, I've gone from a reading of 330 down to 160, so I've cut it in half.
Wow.
I quit taking all my medication. And my question was, you said you just do one kale shake a day?
Okay, good question. So Randy, your diabetes is improving, you're coming off your meds, blood sugars are doing good. So your question is, do one kale shake a day. Now, depends on how big that kale shake is. For example, when I do kale, I will take the blender and I'll fill the thing probably 3/4 up with kale. I'll put parsley, I'll put beet tops, and I'll put some berries. I like blueberries. Sometimes I use other berries, and then I'll fill the whole thing up with water, blend it for 4 minutes. So now I have the mason jars, which are the big ones, excuse me, and I take, that would fill up 2 of those things. So, excuse me. So it's basically a lot of kale. So that would be, it really depends on how big your cup is. Here's the thing about kale. You can do a lot of kale, and you can drink it through the day. You can do 1 cup. You can do more than 1 cup. There's really no problem with kale other than it could potentially, if you only consume kale, deplete your iodine over a long period of time. If you're a diabetic, I think doing several glasses of kale would be a good thing. The concern with some people is they think that kale is high in oxalates, which basically can convert into kidney stones. That's not true. Kale is very, very low in oxalates. I think personally it's almost impossible to develop a kidney stone from kale. Now, spinach, on the other hand, is the absolute worst. It has like 700 or 800 milligrams of oxalates versus like 2 milligrams from kale. So, but as far as diabetes go, the good thing about kale is it's loaded with potassium and other nutrients, especially phytonutrients that are really good for blood sugars and diabetes. So I would play around with it. Maybe take several glasses and then check your blood sugars and see how you do. I've had people really do well with that. Other people need to switch it to other types of vegetables because somehow they bloat. So we want to make sure we don't get that digestive issue. So yeah, I would experiment. I would definitely have more than 1 glass if you have diabetes. And again, in this show, I always like to make a disclaimer. We're not telling you we're going to cure any diseases. We're not going to diagnose you with any diseases. Check with your doctor. All this information I'm sharing with you is basically tips for you to try out with your doctor and see if it can help you. All right? So that's my disclaimer. I think it's Denise from Ohio. Hi, Denise. How are you?
Oh, hi. Thank you for taking my call.
You're welcome.
I have one question for my husband, and it is that he has a small area in his right hip of what they call Paget's disease, and we didn't know if you had any thoughts on that. And your take on, second question would be your take on inversion tables.
Great.
Thank you.
Now, when we get into certain like diseases and recommendations, I think for that, Denise, I'm going to basically have you maybe call my office, more of a one-on-one, because anytime we're dealing with some type of disease, I would like to know the history and what medications and all these other things versus to give you on the air 1 tip. So honestly, I tell you what, for that question, I would recommend just call my office because it's a more of a, I would need more history to kind of give you that, okay? So sorry, I couldn't give you more, but that's all I can say about that specific disease. Okay? Thanks. Okay, so Mylan from Pennsylvania, you have a question about liver cleansing.
Yes. Hi, Dr. Berg. Thanks for taking my call. From some of the things I'm learning, I think I have a fatty liver, and I've already made all of the diet changes you recommend and recently started using the apple cider vinegar, doing the kale shakes. But my naturopath doctor is recommending that I go on a liver cleanse, and he says it's about the only way that some of the fat-soluble toxins can be changed to water-soluble so they can be eliminated from the body. So my hesitation about doing this stems from concerns from various reviews of people who went on liver cleanses and then had some sort of a toxic reaction or ended up in the emergency room. Can you speak to this?
Yeah, absolutely. So you did get tested. You do have a fatty liver?
I do. I have a fatty liver. I mean, a year ago, I've lost 50 pounds in a year, so I've already done major changes, and I've just recently started, found your channel, and it's been extremely helpful. But yes, I have a fatty liver. I'm still pre-diabetic, although it's heading in the right direction. And as I've been, studying some of your videos, I really think that I have a fatty liver and some mild adrenal issues. So, that's where I'm at.
Okay, great. Let's answer that question. I'm like a human guinea pig, and so is my wife when it comes down to cleanses. I'll put her on a new thing and try this, and I can't tell you how many times that we went through detoxes and got really sick. So there are certain detoxes that will detoxify you, others won't. I'm not crazy about liver cleanses, honestly, especially if they involve powerful, concentrated, herbs, for example, especially ones that can make you sick, because you got to realize that liver is a dumping ground of massive amounts of concentrated chemicals. So when you release it too fast, it can just dislodge to your blood, go to the thyroid, mess with the thyroid, and create a lot of immune reactions. Now, if you do liver cleanses with actual food, you're going to be safe. Dandelion root, for example. And any of the teas are going to be fine too. Cruciferous, kale, broccoli, Brussels sprouts, cabbage, parsley, any of those vegetables, they all tend to stimulate the liver's ability to turn fat-soluble chemicals into water-soluble chemicals. That's called a P450 cytochrome enzyme system. It's a phase 1, phase 2 detox. It's the ability for your liver to change these poisons into harmless particles. So, and they also trigger another antioxidant called glutathione, which also helps to detoxify these chemicals. I've never had a situation where a person got sick from those. So I like either a concentrated cruciferous, that's called DIM, or just the actual cruciferous itself, the food, or cruciferous in tablets, and you're going to be safe. You're not going to have a problem. And that will naturally and slowly detoxify these chemicals from the liver. So that's one thing. That's cleansing the liver. Now, taking the fat off your liver those vegetables will do that because they're high in lipotropic nutrients like choline. Choline is probably the supplement you want to get, not just from food, but as a supplement. Choline is it's really great to pull fat off your liver. Now, obviously, you're changing your eating. You're eating as if you have insulin resistance, which is pre-diabetes, and that's anyone with a fatty liver has insulin resistance. Anyone with a gut has a fatty liver, most definitely. So I would add the choline, start cutting down the insulin stuff, the things that trigger insulin, do intermittent fasting, all the things I talk about. I think you're going to do really fine over time. The thing with the fatty liver, though, it does take a while to clean that thing out. It could take up to 3 years to get your liver back in good shape, but you'll see great positive benefits. So, yeah, I'm not into cleanses just because it's going to make you sick. And who wants to wait 10 days to 2 weeks to recover, to only dislodge a small amount of chemicals? So I like to do it from food and take your time doing it, okay? Hope that helped. All right, so then we have think it's Arlena from New York.
Hello?
Hi, how are you? You're on the air.
Yes. Hi, Dr. Berg. Quick question. So I had a back injury back in June,
Mm-hmm.
and I was diagnosed. I had an MRI, and the doctor told me that I have a minor compression fracture in T12, and I also had some annular tears. I can't even pronounce that.
Annular tears of the disc. Yeah, that's tears around
right.
the outside of the disc. Yeah.
Yeah, L5 and L3. So yeah, I mean, I think the minor compression fracture healed by now, but I was wondering, is there a way, because I know that the annular tears, they don't really heal completely. Is there like an exercise regime or supplements that you recommend for that as a chiropractor?
Mm-hmm. How old are you?
27.
Wow. And you have a compression fracture of your
Yeah, I had
vertebra?
a compression fracture. Mhm.
Did you
It was very minor, they said.
did you injure yourself?
Yes, yes.
Really severe?
It was a pretty bad injury.
Okay.
Perhaps because I was, overweight, for my height. But yeah,
Okay.
they said it's not really bad. It's minor. But I think by now it's healed. But like, what really worries me is the annular tears, because I know that any damage done to your disc, they don't really heal completely. You form a scar tissue and all that. But like, yeah, I'm trying to do low impact cardio, swimming, and stretching. But is there anything else you would suggest, or any supplement? I'm also taking gelatin.
Yeah.
For that.
Okay, great. Let's answer that. You're very young, had a compression fracture. Usually the bones should withstand unless it's a severe impact. My diet was very, very poor growing up all the way until I hit probably my 20s. I ate only sugar. As I went into wrestling practice, I wrestled in high school and college, cut weight. So you can imagine all the bad things were happening inside. I had no idea what was going on. I started getting fractures of my neck, my ankle from very small, things. So I probably had some osteopenia back then, which is the demineralization of the bone. As far as to use supplements to heal the disc damage that you have, which is a tear on the disc, and also to support the bone, the number one vitamin that you need to start taking immediately is vitamin K2. Vitamin K2 takes the calcium out of the soft tissues, out of your arteries, out of your joints, and puts it right in the bone. It makes your bones really, really strong. It helps support the proteins that transport calcium. So to make really strong bones, vitamin K2. Now, there's a lot of different versions of vitamin K2. I like the MK7 version because that's a natural version. But you also want to take it with vitamin D3. Why? Because vitamin D3 and K2 work together to actually build bone. Those are two fat-soluble vitamins. Most people can absorb them unless they have a gallbladder problem, in which case they need to take some bile salts or purified bile salts or gallbladder support. But K2, D3 are a must to regenerate that. Also, that will also help the discs, and vitamin D3 will also help the disc as well. The other thing you want to do is take some trace minerals. Trace minerals are like the catalysts that allow proteins to grow in your body. And I'm not just talking about hair and nails. I'm talking about collagen, connective tissue, disc, anything with the joint, ligaments, tendons. Gelatin is I think a poor source of collagen. You probably want to get a more high quality, either a bone broth or a higher quality collagen supplement with that, with trace minerals. That's what I would do. Trace minerals are essential. Those are all the tiny minerals that you need in smaller amounts that activate the proteins, and that'll slowly start building you up. Of course, this is on top of a really good diet, but you can heal those discs. They do come back unless it's completely, disintegrated. But if it's a small tear, you can grow those back. But I would do trace minerals, fat-soluble vitamins, vitamin D3, K2, and collagen. I think that's going to help you the most. But I've seen people do very well on that. Okay? All right. So Maryland, we have T from Maryland. You're calling right down the street, right shoulder pain. Go ahead. You're on the air.
Hi, Dr. Berg.
Hi.
Thank you for taking my call.
Sure.
I have some right shoulder pain that my orthopedic has sent me to physical therapy for. I've tried massage therapy. I've tried acupuncture. And I've tried your tool. I purchased your tool, but the pain isn't getting any better. And it gets to the point where it almost looks like I've had a stroke because my arm just does not move.
Okay.
So I was wondering what else could I do? I'm taking the adrenal and the cortisol and everything else, but
So
no relief.
I have a question. Do you have any digestive problems, bloating after eating?
Only if I eat like cauliflower, kale, or something like that.
Do you have any constipation?
No,
Do you have any history of gallbladder problems?
no.
Have you ever worked on your gallbladder?
No.
Okay, so let's just do a little demo here, live on the air right now. Do you have shoulder? Is your shoulder hurting you right now, or was it not going up?
It won't go up. Sometimes they've told me that they think it's a pinched nerve because sometimes
Right, but right now,
thinking pain.
right now, is
Yeah.
it restricted in motion or is it hurting?
It's hurting. It's
Okay.
like an aching pain right now,
Okay.
and I can move it, but not completely up.
Perfect. Here's what I want you to do, an experiment. I want you to take both of your hands, your fingertips, and I want you to massage underneath your right rib cage. Okay? On your right rib cage,
Okay.
really close to about an inch off the center to the right underneath your rib cage, maybe an inch down. Tell me when you find the tender spot.
Ooh,
Found
I
it?
found it.
Okay, massage that a
Uh-huh.
little bit. Just massage that for about an hour. We're going to be waiting. No, just kidding. Keep massaging it for... Okay, good. Did you do that?
Yes.
Okay, now tell me how your shoulder's feeling now.
Tired.
Tired, yeah, because you're working. See if it moves better.
Yeah, it moves a little bit better.
Yeah. 95% of all these right shoulder pain problems are gallbladder referred. There's a nerve that comes from your gallbladder all the way up to the right shoulder, right up into your neck. It's called the phrenic nerve. You should type YouTube, Dr. Berg, right shoulder pain. It's not coming from your shoulder. That's why all the therapy does not work. I had right shoulder pain for 20 plus years. And I've done every single therapy on the planet. Nothing helped until I started doing massage on my gallbladder. I know, it's weird, but it works. And so I would later today start working on your massage on your gallbladder. And this is actually, even if you have my tool, oh no, it's probably not in there, is it? Okay. Yeah, I didn't actually have that in the little manual. Whoops. So anyway, I would work on the gallbladder, and I would do on the left and right side because you have two nerves, and you'll see that your shoulder pain will completely go away. Also, you want to start looking at possibly supporting it nutritionally with some like gallbladder support, and not the adrenal support, but the gallbladder support. And the third thing is you want to make sure that you are eating to support your gallbladder. So that means that you might want to try giving up the nuts. Are you eating a lot of nuts now?
I was eating a lot of pecans and macadamia nuts.
Yeah. Unfortunately, the nuts tend to aggravate the darn gallbladder, and it can cause the pain. So just by cutting that out, you'll see instant relief on your right shoulder. You want to increase the vegetables. But do the massage on the gallbladder. That is where your problem is. It's not coming from your shoulder. Because when you step on a dog's tail, he barks to his mouth, right? So there's
Right.
a referred type situation. All right? So that's what you need to do.
All right, thank you.
You're welcome. All right, so Adrian from Las Vegas, right ear, pulse, sound, and gallstone. Go ahead, you're on the air.
Yeah, hi, Dr. Berg. Thanks
Hi.
for taking my call. Yeah, I called because it's been going on for, maybe several months, and then just recently, the past 2 weeks, I would hear like how, I've had 4 kids, so when you go to the doctor and they do the ultrasound, and you hear that pulsing sound, that kind of sounds like the baby's heartbeat is underwater. I'm getting that in my right ear.
Okay.
And I do have a gallstone. It's kind of mild because I've been following your recommendations, and I've been changing my eating habits and doing the apple cider vinegar drink, and it's helped a whole lot. But I'm wondering what's going on with that ear and with my gallstone. Should I be taking your biosalt formula?
Yeah.
And then I have one more really quick question I forgot about. I have a bone spur on my right ankle. I used to see a podiatrist for it, but I stopped seeing him a year ago because all he wanted to do was give me cortisone shots every 2 weeks. And after the second shot, I said, no, thanks, I'm out of here. I never came back again.
Okay, great. Let's answer those
I'm wondering what I
questions.
should do about that.
Yeah. Okay. So first of all, the gallstone definitely will dissolve it as the gallbladder formula, which has the bile salts in there, and stone root and betaine, hydrochloride, and enzymes to help you help support the gallbladder. That's number one. That will probably resolve that with the change of your eating, cutting down insulin foods. Okay. The pulse in the ear thing is a low potassium. So when you can hear your pulse in your ear when you're going to sleep or right now, that just means you have low potassium. Low potassium causes the heart to work harder, and it can even increase the pulse rate. Now, you go to the doctor, you get your blood tested, and you find normal potassium. That's because 98% of all the potassium is inside the cell. So it's never going to show up on a blood test. You have to do a special test to measure your intracellular potassium levels. So you don't even need to do that. You just need to take some potassium. I would do the electrolyte drink. That's 1,000 milligrams of potassium citrate per serving. And you'll see the pulse rate come down over the next few days. That's what I would do. Usually the potassium deficiencies come from eating too much sugar or stress, or your digestion is off. So that's what you need to do. It's a simple potassium deficiency. I remember before I was getting married, we were going around sampling. This was a long time ago before I knew about nutrition. I started sampling these wedding cakes. So I would be, I think one day went to 7 different places and I was sampling wedding cakes. And then we ended up at an Italian restaurant. And then we started eating this Italian food, which I loved. Pizza, pasta, and the dessert chocolate cake. And then I look around, I'm like, we're the last people here. So we're closing up, and they're right next to us. This guy comes with this dessert tray, and they're going, yeah, we're going to shoot these out. Do you want to sample anymore? And we're like, well, we don't want to waste it. So we started sampling more and more. I've had more sugar in that night than I've ever had in my life. So we're driving home, and I'm hearing my pulse rate in my ear just pounding like crazy. I do not think I slept 1 minute that whole night. But that basically what happened was all that sugar depleted my potassium. Big time. So and then also the spur to help you with that. Probably I would just fix the gallbladder, because then that will help you absorb the fat-soluble vitamins like vitamin K2, which you might want to be taking as well, because that actually kind of takes the calcium from the places it shouldn't be in the soft tissues to the places where it should be in the bone. All right? Try that and let me know how that works. All right, so I just want to answer one question on the chat on my YouTube channel. Someone had a question about H. pylori. Okay, that's basically a bacteria that happens in your stomach, and everyone kind of has it there inactive, but it activates when your pH becomes more alkaline, and then that darn microbe causes your stomach to be even more alkaline. And now you can't digest, and then you get an ulcer, and then you need an antibiotic and the whole thing. So the best thing for H. pylori is to start acidifying the stomach and keep your stomach really acidic. I like apple cider vinegar. I like kombucha tea. And if you're on antacids, that could be why you have the problem. So again, the solution is to keep your stomach very, very acidified. All right? So we have a question from Michelle. You're in Alabama. Hi, Michelle.
Hi, Dr. Berg. How are you?
Great.
Good. I was calling for 2 quick questions. First, for you to explain the early dawn effect. Secondly, it's allergy season in Alabama. I am a big tree and grass response to that. And I was wondering, is it the seasonal allergies that's having my fasting glucose so high in the morning?
Your what?
Because my fasting glucose.
Oh, fasting. Okay, got it.
Is high in the morning, and at one point I've been doing the ketogenic diet for a couple of months, and it was under 80, which I think that's what it should be fasting. But all of a sudden it's 90, 89, 90, sometimes even 100, and I'm thinking, what's going on?
Okay. Michelle, do you know what normal blood sugars are?
I think if you're doing the ketogenic diet, you want it to be 80 and below, between 69 and 80, right?
Okay. Yeah, but anything up to 100 is normal.
Oh, okay.
So you might actually be okay. But of course, over time, you will see that the blood sugars will come down if you're on it longer. However, allergies add a huge stress. They stimulate cortisol, and the cortisol is probably releasing a little more sugar. So yes, the allergies are doing it. If they're seasonal, you can take, this is the only time I'm going to tell you to do this, but take some calcium ascorbate, which is a synthetic vitamin C. Get the non-GMO kind. And it's a temporary measure to take a couple grams through the day with bioflavonoids to help dismantle the allergy reaction or the histamines. That is one of the only things I know that will just knock out the histamines pretty fast, and you can actually get relief. So it's calcium ascorbate, which is a non-GMO synthetic vitamin C with the natural 2. Now, if you can also, I'm not familiar with early dawn effect. Can you tell me what that is?
Well, it's this thing, I don't know if it's from food or the environment, that supposedly if you're doing all the right things in the diet, but you wake up and your fasting glucose is still high.
Oh, okay.
I think the term is early dawn effect, but I don't know what causes it. I don't know what you do to correct it. So that's why I thought I was calling to see if you had heard or know how to fix that.
Okay. Okay. So hold on a second. I just want to make sure this mic, is this okay? Is this better? Okay. Good. Okay. So, all right. So Michelle, if you wake up and your sugar is high, what that means is that the liver needs more support. So you want to support the liver. Milk thistle would be really, really good. Keep eating healthily. Over time, that'll get better, because what happens if the liver cannot regulate blood sugars or mobilize fat to stabilize sugars when you're eating and you're fasting, which is at night, you could end up with a little either a high sugar or a low sugar, depending on what's going on with a kick in from adrenaline, or which can then spike and then lower it. So I really think that early dawn effect is you just need to keep supporting the liver. And I like a couple things. One is the milk thistle would be really good. The other tea or actual supplement or actual vegetable would be the dandelion greens. Now, those are the dandelions in your backyard, but those things are really good on the liver. It's also a diuretic, but you put them in a salad. And you cut them up. I like to put them in salad. They're kind of like really bitter, but that's what the liver loves. Okay? All right, Michelle. Okay, so Valerie, you're from Ohio. You're on the air. Go ahead.
Hi, Dr. Berg. I have actually two questions, one for myself and one like a community problem. I take great care of my teeth. I floss, I brush. I actually brush with baking soda and coconut oil. And I have receding gums for whatever reason. And the second question I have is coming as a nurse. My concern is that there's an epidemic of alcohol and drug abuse in our area, and a lot of overdoses. I was wondering if you have any dietary changes that can actually help with addiction and that overall craving that people have that keep wanting to use.
Yeah, good question. I need to do a video on that. I need to actually write a little booklet on that, because there's a lot of people that want to come off drugs, but they're addicted. There is something in your brain. It's a little tiny center called the nucleus accumbens, which is up in the brain, that gets triggered by cocaine, by other medications and other drugs, that then give you that feeling. And that is the center where you have all these different the reward centers of the body and the pleasure centers in the body. So really, the triggering of the pleasure effect is really your own body making yourself pleasure. It is really not the drug. So it's a trap. It's like, kind of like this artificial sense of well-being and euphoria from the endorphins, but it's really such a trap because then you need more and more of it. There's a couple things that you can do that I would do because the drugs deplete the nutrients. You have to, in this case, you would want to do large amounts of the B vitamins, primarily B3, niacin, and also B1 with calcium and a good calcium lactate and also a natural vitamin E. Those are the ones that I really use a lot to help reduce the addictions. The other thing is that you got to get the person's willingness to come off the drugs. That's always the biggest problem. But if they can start treating themselves as if they had like a real major nutritional deficiency, you can decrease the cravings. And then also give them substitutes for that, natural good substitutes as they're transitioning off that have a calming effect. Valerian root, make sure their sleep is good. Kombucha tea is a really good calming, has a calming effect. Magnesium has another calming effect on the nervous system. But B1 is probably the number one thing you want to focus on to create the effect that you need to use. Valerie, I think you had one more question that wasn't related to the drug addicts.
Yeah, I take great care of my teeth. I always have.
Oh, the teeth,
I floss
that's right.
a couple of times a day. Yeah, and I kind of went off of regular toothpaste and started doing baking soda and coconut oil mixed together.
Mm-hmm.
And I've for whatever reason, I've had receding gums, and it's not getting any better. I don't know if it's getting worse, but I have receding gums that are actually exposing my root, and I'm concerned about it, and I don't know how to take care of it or kind of what the root cause of it is.
I'm going to do a video on that that's more comprehensive. The quick version to build up the gum, it's a combination of building up. The gum is composed of collagen that is supposed to, and it's kind of similar to the joints. Like how would you fix to build back up the joints and the different connective tissue that's in a joint? And it could come from several nutrient deficiencies. One is vitamin C. So, for example, you have people that have years of not eating enough foods with vitamin C, and then they have receding gums, and they have bleeding gums, and they lose that connective tissue. So vitamin C is essential for the conversion into connective tissue. And then you also have the collagen itself, but that's usually rare to have a collagen deficiency unless the stomach, your stomach is too alkaline. And if your stomach is too alkaline, you have like indigestion, and that can create an inability to absorb and mobilize collagen. So if I were you, what I would do is I would start consuming foods high in vitamin C. Peppers are the best. And then I would also maybe take a vitamin C complex. I would also probably take a bone broth or some type of collagen that you can take that is a high quality thing to start building it up. But I will do a video on that specifically to give you some additional things. I don't think you can completely 100% reverse it. I think you can improve it. But once it's gone, it's really hard to recover that. Okay? All right. So let's see. We have Naya from New York. Go ahead. You're on the air.
Hi, Dr. Berg. Thank you for taking my call. I have a question about having blood clots during your menstrual period. I know this is like TMI, but I'm in a lot of keto groups on Facebook, and a lot of women complain about having very large blood clots that they don't normally have. And now this month experienced it myself, and it kind of freaked me out, but I was like in a lot of pain. And I was just wondering what causes that, because I think I read in the past when I was doing Atkins that a low-carb diet can cause that, but I just don't know why.
Okay, good question. The absolute best thing you can do for that, and that is a omega-3 deficiency. So all you need to do is start adding more omega-3 oils. You can do that with fish oils. You can even do it with flax oil. But omega-3 is what you need to counter that effect. The other thing, if there's also heavy bleeding during menstruation, that means your estrogen is off. So in that case, I would take some natural nutrients to balance estrogen, cruciferous, and something called DIM. That will also help you normalize that. All right? Okay, so we have a song from London. Go ahead, you're on the air.
Hello, Dr. Berg.
Hi.
Thanks for taking my call. I have long, well, not long, but for about a couple of years, I suspected that I might have some mercury poisoning. However, I took a blood test, and my mercury levels were next to insignificant.
Your mercury your levels were what?
Were very low, so
Okay.
it didn't seem like I was
So
from the blood test like I had mercury poisoning.
So how do you know that your mercury would have mercury poisoning?
No. So I suspected that I had.
Okay, got
and
it. Okay.
the reason why I did is because I had significant and very quick hair loss. Also, I suffer from a lot of anxiety, trouble sleeping, trouble concentrating, now loss of memory. So like at the drop of a bat, I'll be thinking about something, and all of a sudden I will forget about it. Or you could tell me your name, and in about 5 minutes I would forget.
Do you have a history of blood sugar problems or not?
Not that I'm aware of.
Okay. So here's the thing that you can do as far as those symptoms. It sounds to me that I would use kind of like something to boost the memory and possibly something that'll detoxify you if you suspect mercury poison. And the best thing for that is glutathione. You can take it as a supplement. You want to get glutathione reduced. Okay, that's what it's called, glutathione reduced. And I like that in that it's you won't feel sick from it. It actually supports the cell and detoxification. They use it for Alzheimer's and Parkinson's, so it's good for memory and clarity and energy levels. And then, of course, I would eat the foods that will trigger that antioxidant too. That would be all the cruciferous vegetables. So I would start doing that. And then keep watching my videos, because you may also have a blood sugar problem. And if that's true, then you need to start to apply some other stuff with supporting insulin resistance. Okay? All right, so let's see. Narla from California, you're on the air. Go ahead.
Hi, Dr. Berg. I am 51 years old and I'm pre-diabetic. My sugar fasting 104. It was 1 year ago. It was 106. I was on diet 1 year, and it's 104 still. They do the study for 3 months, so it's still high.
Okay.
For me, I have fibroids all my life, ovarian cyst. I removed one cyst a few years ago. And now I did ultrasound last week, and they said I still have fibroids and a complex ovarian cyst on the right ovary, which is only one ovary I have. I tried ketosis. I tried everything. I lose weight really slowly. I use your estrogen balance and adrenal ketones, cortisol balance and all of that, but I don't know what time should I take it.
Okay.
Because I don't want to go through surgery again.
Right. I hear you.
They want to do surgery for me again.
I hear you. Okay, so let's just talk about that. I think as far as the what time you should take that, honestly, that's a very minor point. You can just take it, spread it out with meals. You can take it in the morning. It doesn't really matter. The only one that matters is the adrenal night formula. You take that before bed. Everything else you can take any time. It still goes in. Now, the second thing that you mentioned with these cysts, I think I would start doing sea kelp, because that will decrease the need for estrogen, and that seems to be targeting the cyst directly. I'm going to be releasing a video on polyps. That's something a little different. But for you, I would do sea kelp, especially if it's related to the ovary and cysts. Okay? All right, thanks. Let's see. Rhonda, you're from California. Welcome. Rhonda, you have a question about toning? Okay, Rhonda, you might have dropped that call. So we're going to take another call from Carlin from Atlanta. Carlin. Hi, how are you, Carlin?
Yeah, hi, Dr. Berg. I have been watching your video the past 2 weeks, and I think you're about to change my life. I love your videos. Thank you very much for spending time. I have a question. I have thyroid. I'm on nature's thyroid right now, and I cannot get hungry. I can go for 18 hours without eating and not even be hungry. And doctors tell me that's unhealthy.
Okay.
What should I do?
Do you feel tired? Do you have any other symptoms?
No, not really.
Okay. So let's just talk about that. So when you are not hungry, and of course you've been applying some of the information that I have, which is intermittent fasting, handling insulin, and you also have a thyroid, which means that metabolism is a little bit slower. But here's the point. It's totally okay to go for that period of time without eating if you're not hungry, because your body is actually eating its own fat. And this is the thing that it's interesting, because I'll have people start this program and their hunger goes right down and they feel nervous like I should be eating. Not necessarily. Not if you have no other symptoms and you're in the time that you are eating, you're eating a nutrient balanced meal. The goal is at the end of the day you have all the required nutrients in that meal or meals. I do have a smaller group of patients that are doing 1 meal a day. They're doing fine. And they're doing that because their metabolism is so slow. That seems to work for them. Our bodies weren't necessarily meant to eat every 3 hours. It's not designed to do that, or even 3 times a day. It's kind of bizarre. But we're just constantly put into that habit. So if you're not eating, don't eat. Now, if you have symptoms like hair loss or fatigue, well, of course, there's something going on, but I think you're probably in fat burning and your body is mobilizing your own reserve. So a lot of people have a lot of weight to lose. If you have like 100 pounds to lose, I mean, it's going to take a long time if you have 3 meals a day. Like, I would create a situation where your body's in fat burning for a long period of time, and then you can eat, have a good meal, then you fast for a period of time. That's the healthiest thing to correct it, to rejuvenate the metabolism and lower the set point. So I think you're fine. I would ride the wave, keep going, and don't eat if you're not hungry. All right, so let's see here. Mary, you're from Scottsdale. Go ahead, you're on the air.
Yes, hi there.
Hi.
Can you hear me?
I can hear you.
Yes, good morning. I called because I've been struggling with post-traumatic stress disorder. I had a car accident 6 years ago now, and overnight I literally, like a switch, developed bulimia. I haven't been able to go much longer. I haven't been able to not go without it. Mm-hmm. And the PTSD, with all the anxiety, the depression, and the panic attacks, it's a nonstop thing, and I can't seem to put an end to it. And I've sought help, so-called professional help, but nobody seems to understand it because it's very complex. So I'm not sure if there's anything you could help me with.
Great, Mary. So let's just give you some tips on that, okay? Sounds like you have a lot of symptoms of the adrenal gland. If we support the gland that can create those symptoms, anxiety, panic attacks, I think that will bring you up to the point where you can kind of get a grip on it better, because what happens when you're under stress, you kind of go out of the present time, and it's hard to make logical decisions, so you'll do things that you regret. And so I think the best thing to do is align the nutrition, your exercise with the adrenal. That means going for very long walks during the day, getting space. That means having a lot of B vitamins, nutrition to support the adrenal. I have an acupressure tool that will really, you can do this twice a day and start to pull stress out of your body so you can sleep better. And also the key is the sleeping. Support the adrenals to sleep, because if you can sleep better, you'll see it'll be way better during the day as far as your anxiety and your stress level. So that's what I would do, Mary. Try those things, and then, stay in communication with my office and if you have any additional questions, okay? All right, so Doug from Arlington, you're right down the street. How are you?
I'm fine, Dr. Berg. Do you make a distinction in your diet between animal fat and vegetable fat versus vegetable oils, difference between fish, pork, chicken?
Yeah. Yeah, good question. That's I think that would be a good video I could do. But let's just give you some data that I have on that. The gallbladder is stimulated by saturated fats. Now, you do have saturated fats in coconut oil, okay? So that's a vegetarian type of oil, but most saturated fats are from animal products. Honestly, I don't believe there's a big problem from consuming animal saturated fats as long as you're not eating sugar and any other junk at the same time. Now, the problem right now that people are running into with vegetable fats is that if you go to the grocery store and you buy mayonnaise or dressing or any number of foods, the number one ingredient is soy oil, which is a vegetarian oil, which is usually GMO. So it has trace of glyphosate and hexane, and which is a chemical, and other terrible things, and it's very estrogenic. So I think people are doing way too much of that, and then corn oil, which is another thing. So you have safflower oil, you have olive oil, which is awesome, but that's not saturated fats. That's unsaturated fats. I think a combination of both would be good, but in the animal fat, like even butter, for example, it's loaded with vitamin A, also over 400 fatty acids, which are essential for the brain, for the cellular membranes, for the nervous system, for hormones. So when people start cutting out their animal fats, it's very hard to get vitamin A, for example, or even vitamin D, like even cod liver oil. So there's a lot of other nutrients, like CLA, which is a healthy fat for your metabolism and for the decreasing risk of heart disease, in these saturated fats, animal fats, especially if it's grass-fed. So as long as you're doing grass-fed products, I think you're going to be okay. And if you can't find grass-fed, then you better do organic. At least it's without GMO. But it's so funny, like you see these eggs, for example, fed vegetarian feed. Yeah, well, that's GMO, soy, and corn. Like, what else are they going to feed it? Like animal waste? Well, so you really want to do grass-fed, pasture-raised eggs or organic. You want to do grass-fed meats, and then you'll consume some really good, healthy fatty acids that are essential. But the main thing is the fat-soluble vitamins that you need in those animal fats, because even the vegetable fats, you're not getting the active form of vitamin A, and it's really hard to get vitamin D. So those are some things that I would point out, but I'll have to do a video to really tie in everything. All right? Cool. All right, Patty, you're on the air. You're from Houston. Go ahead.
Yes, Dr. Berg, thank you for taking our calls. I was wondering if it would be better to be in ketosis instead of eating a keto cookie after your meal, to eat a small piece of fruit.
Very good question, Patty. Now, Patty, you want to get into ketosis and lose weight, right?
Yes.
Okay. Are you aware that there's a good amount of sugar in fruit?
Yes, I am.
Yeah, that's going to bump you out of fat burning right there.
Oh, okay. All right.
It's much better.
Thank you very much.
You're welcome. It's much better if you consume that keto cookie, but just smaller amounts, and then make sure you don't snack between when you eat and the next meal. Then you'll really do well. Some people go crazy on the keto cookies and they can't stop eating just one. They eat a lot of them, and that is the problem. And some people don't even need that. But in the transition, especially when you're starting out, I think people need those keto cookie type recipes to be able to do this. Personally, I don't need it, but it's nice to have it around occasionally. So yeah, I wouldn't do the fruited snacks because that's going to be a problem. Hannah, you're from Ontario. How are you?
Hi, doctor.
Think you have a question? Are you losing your sense of smell?
Yes, I'm sorry. I thought I lost you. Thank you for taking my call. Yeah, doctor, a few months ago, I started to lose my sense of smell, and now the sense of taste, it's going on some stuff, and also at the same time, like soap or a cucumber, and many things like smell the same to me, and I'm just wondering, like, what should I be looking at?
Okay. All right. It's very simple. It's just you want to get a good quality zinc supplement, and that usually will recover your sense of smell. Loss of smell, loss of taste is a zinc deficiency. So just go ahead and get some and let us know your results, okay? Okay. Salam from New York. You're on the air.
Yes, hi, Dr. Berg. Thanks for taking my call.
My pleasure.
My wife has the past 10 years, her head is twitching without her intention, and sometimes it's not that strong, but sometimes it's very strongly. And she was hospitalized also, but the doctors couldn't find anything. So I just want to know what should we do for her.
So is it a twitching or is the head shaking?
It's not like Parkinson's shaking. It's like one twitch from right to left, and
like
then
the head
stops
twitching
in
like that?
5-6 minutes. Yeah.
Okay.
Like without her control, and then after that, it's like a strong, like somebody touching somebody or slapping somebody from right to left, and that's only right to left. It's not up and down or something.
Okay. So usually those, they call them tics and things, can be resolved by supporting the neurotransmitter system, which are basically hormones within the nervous system. And I find the biggest deficiency has to do with something called acetylcholine, which is supported by vitamin B1 and choline, okay? Vitamin B1, find a natural source of vitamin B1. You can do nutritional yeast, and then choline. And I would take that for at least 3 weeks, and that should actually help her with that. So somehow she's deficient in those two nutrients. All right? Okay, so Ricardo, you're from New Jersey. You're on the air. Go ahead.
Oh, my God. Hi, how you doing, Dr. Berg?
Great.
Thank you so much for taking the call. My question is, I've been in doing the ketogenic diet for the past 4 months, and I do extenuous, exercise. My whole life I'm doing it. But my question is, I've been trying to gain muscle the right way, like following your videos. I really appreciate it. But my question is that I started to take creatine in order to support or help me out. I just want to know if that can slow me down or help a little bit, or I don't even know if I'm doing it right. And my question is like if that keeps me out of ketosis, or what kind of problems can give me doing the ketogenic diet.
Okay. Well, first of all, creatine, when you take this as a supplement, it's kind of a recovery nutrient for the muscles. It helps to, there's claims that it helps build muscle mass. I really haven't seen amazing results from that. It may, but it does, on the other hand, stimulate a little bit of insulin. So that may be keeping you from progressing, especially if you want lean body mass, or do you want to just bulk up, I think the best thing for you, Ricardo, would be to do things to stimulate testosterone and probably growth hormone, which are very similar. So that would be a short, high burst of high intensity, full body compound resistant exercise with lots of rest, focus on your sleep, and then also offset that with not doing that every day. Like, I'll give you an example. I'll have people that they want to build their muscle mass, they want to lose weight, and they are working out this high intensity workout. They're doing CrossFit, and they're doing it like even every day or every other day. I will take that workout, especially if they're in their 40s or 50s or 60s, and I will say, okay, do that once a week, and they get incredible results. They get amazing results. So the recovery is like senior importance versus the actual workout. And I would not go back to that workout until you fully recover. Like these women that go to these boot camps and they do it even 3 times a week, they overtrain and they plateau. They don't get anywhere. So it's much more important to give your chance to heal. I think you should be doing that workout, but not as frequent. And I like the workout itself because we want to get our body in a state where we're breaking things down, but you got to let it build back up. The next thing as far as eating goes, insulin, I would even try to do 2 meals a day. Believe it or not, that will actually increase muscle growth because it'll stimulate the fasting response, which triggers growth hormone, which then will cause a lessening of the breakdown of muscle protein, and it tends to preserve the muscle itself. So that's what I would do, and I think you'll see good results. The key is make sure you don't consume any sugar in your diet at all, okay? And keep the vegetables high to keep the liver high, okay? So we have another call from Virginia. I think it's Elaine. Hi, Elaine. You're on the air.
Hi, Dr. Berg.
Hi.
Elaine Nielsen here. Hey, I have a question for you. I told somebody I would ask if I had the chance, so I am. I have a friend who has been in pain for years, and I never really got into it with him until this last winter when I saw him. And he started telling me some of his symptoms, and I asked him, I said, he was pooping oil, okay? I said, do you by chance have a gallbladder? And he said, no, they took that. I said, did they give you any bile salts or something to go with it? No, they gave him some enzymes. And then he told me, so I set him up with some bile salts, and he's very happy for that, by the way, because he's been sick ever since they pulled this gallbladder. But he said that when they did this, they said that his pancreas was that of an alcoholic, meaning it looked scarred or something. They described it as being angry, and he doesn't know what that means, and I didn't know what that means either. So I'm asking you, do you have any idea what that means? He doesn't drink. The doctor was really surprised to hear that he doesn't drink, and he doesn't. He's not a drinker.
Okay, so the pancreas, a good question. You have the pancreas and the gallbladder work together. And the gallbladder releases bile to help you break down the fats into a small particle, but the pancreas releases lipase to take that small particle down to the smallest particle that you need to absorb into the body. So I think what's happening without the gallbladder is putting more stress, a lot more stress on the pancreas because it has to do all the work, and he's depleting his enzymes. And that you would get like skid marks on the toilet seat or dark tarry stool. That is a pancreas problem. So, of course, you can support the pancreas with enzymes, especially lipase, and support it even with a standard process product called pancreatrophin PMG, which I really like a lot. But the pancreas destruction can come from alcohol, but it can also come from different things too. A long history of eating a lot of cooked foods will destroy the pancreas. Like you don't eat anything raw. And because the pancreas is constantly making enzymes, so if you eat heated food or food that's kind of cooked, then your pancreas has to do all the work to make the enzymes to digest the food. And that is the problem, start doing raw foods, start supplying raw foods for the enzymes that you need. The worst thing to do also would be to do canned foods. Like you don't want to do that at all. All right? Okay, Scott, you're from Georgia. Go ahead. You're on the air.
Yes, sir. Thank you for taking my call. We've been watching your show for a while and enjoy it and the videos. I had the flu at the end of January, and I developed a bacterial sinus infection, and so the doctor prescribed me Ceftonir for the bacterial sinus infection, and apparently it killed all the good bacteria in my gut, and so then I developed C. diff, and it's been a tough go with that. Well, the gastroenterologist this week prescribed me vancomycin, and they've put it in a suspension. And I asked the pharmacist if it was sugar because I'm on a ketogenic lifestyle diet, and I keep my carbs, intake low, and I do intermittent fasting as well. So will this affect my ketosis? What should I do there? Is
Good
this
question, Scott.
I mean,
so this is what you should do, Scott. Number one, you want to start taking a really good probiotic. I would try to do some research on effective microbes. Effective microbes are called EMs, and they have a great natural probiotic that's a symbiotic microbe to start building up your flora. Very, very important. I would start doing fermented vegetables. But yeah, you're right. You're going to kind of knock yourself out of ketosis with that hidden sugar. The other thing that you want to do for C. diff is you want to take oregano oil with pearls. And you start taking that, and that will start to put your immune system back, because that's like an antimicrobial, antifungus, anti-mold, and without killing the good guys too. So that's what I would do, and I think that should help, Scott. So thanks for calling. Hey guys, we ran out of time, and I just want to say I appreciate your great, amazing questions. Until next Friday, start watching my videos. Have a great week.